to inhibition of cellular respiration. So good. So that would lead to low blood pressure, increased respiratory rate. Bitter almond breath is a classic sign. And then what would you do to treat this? You'd give a sulfate or a nitrate to increase methemoglobin. Cool? Any questions on that? So that's, again, one of those classic things that you want to look for. If something comes up discussing cyanide poisoning, particularly after being near a burning house by fires, that's going to increase your risk of cyanide poisoning. Being by fires also increase your risk of carbon monoxide poisoning, but that will classically present with being really short of breath and having very well perfused pink extremities. Yes, Lily?
Why would you want to induce?
Yeah, so in that type of situation, you essentially, from what I remember, you want the cells to just bind to cyanide, bind it tightly, and not let it bind to other red blood cells. Not let it go to other tissues. Just kind of sequester it is the goal there. Can I get a concurring opinion? Do you agree?
Yeah, I actually didn't remember that exact example,
Okay.
so
That's how I remember it. That's the physiology that I remember. You want to just bind it, sequester it, and not let it spread to other cells. Good, is that good?
Oh, I have an explanation.
Yeah.
But I could talk to that person.
Okay. Or do you want to share it with the group?
Yeah, I have it in my book.
Do you want to speak in front of the mic?
Sure, let me find it. I have it written.
We'll get back to that in 1 second. Okay.
Put a pin in that.
So next question. A newborn is born with failure to thrive. So what does failure to thrive immediately make you think of? It makes you think of some sort of birth defect, often due to inborn errors of metabolism. So that's kind of how you want to sequester yourself. Born with failure to thrive, with ketones in their urine. So that's a sign of metabolic distress. That's not normal. Their urine is positive for leucine and isoleucine. What types of amino acids are those? Those are branched amino acids. Good. And what type of disease is due to a defect in branched amino acid metabolism? You haven't.
Oh, they haven't gone over maple syrup.
Okay, I'm sorry about that. That was on our first exam last year.
Wait, we have to remember how.
That's not.
Don't worry
a
about
first
it yet.
exam? Okay, so I guess that isn't on your exam. Okay. So the next question is discussing. No, oh my God. Sorry about that.
Oh, you? Yeah.
What was? Is it? Yeah. So maple syrup urine.
Maple syrup urine disease.
So what is it?
Actually, really long question.
So, you said you go over it right now.
So based on what I'm hearing over here, there's a chance it is on the test. So let's just go over it briefly in case it does come across. Okay? Is that okay? Okay. So maple syrup urine disease is a disease where you're unable to manage branched amino acids. Okay? So that's leucine, isoleucine, and valine. Okay? Those are your classic ones. Those are broken down by alpha ketoacid dehydrogenase. So you'll present with leucine and isoleucine in your urine, and those children will have smelly, smelly diapers that smell of maple syrup, okay? Smell like maple syrup, okay? And then you immediately think branched amino acids. Those children will often present with metabolic issues, so really low blood sugar, really low energy. So that's something you just want to be aware of if you see a kid like this.
Now they're just Canadian, but
Or they're Canadian, or they're Asian. Cool? Great. Okay. So the next one is, and again, this, I'm not quite sure then if this is relevant. So kwashiorkor is a disease where you have very low proteins, very low protein intake. So that would lead to issues of swelling, edema, and it changes the hydrostatics in your blood. And will allow extravasation of fluids out of your blood vessels into extravascular spaces. So that's the children who you see with swelling in the abdomen, swelling in the legs. As soon as you hear a kid who's only getting rice milk, okay, only getting carbs, protuberant belly, and 2+ pitting edema, then you want to think they have some issue with protein, okay?
Rice milk doesn't have a complete protein profile, amino acid profile.
Yeah. So you're not getting the amount of proteins that they would need.
Yeah.
so what protein specifically are you guys worried about them having a deficiency in? Yeah,
Albumin.
albumin. That's essentially like what is giving you the osmotic ability to draw back in all your lymphatic fluid after it's like kind of hydrostatically like pushed out at the capillaries. So if you're not producing it enough, eventually like your lymphatic system is just going to be overwhelmed.
Which one was that again?
Albumin.
Are you guys responsible for the essential and cool? So this one, a 17-year-old girl with vegan minimalistic diet, very limited nutrition, comes to hear what she can do without. Which of the following substances can be synthesized by the somatic cells of a healthy adult? So what do we think the answer is here? Yeah, okay, cool. Sorry about that, yeah. So remember, specifically you can rule out valine and leucine because those are branched ones that are taken into your diet. And linoleic acid, you'll learn, is a fatty acid that you synthesize, that you need to take in your diet. Glutamic acid, remember you can do transamination from alpha-ketoglutarate to get that, so that way that is a non-essential amino acid. And those transaminations require vitamin B6 or pyridoxine, okay? Cool. And then I included a chart here that I'll put up on the Dropbox that can help you study what's important there. Cool? So we did the metabolism of alcohol. Okay.
Yeah.
What do people think is the answer here? Yes.
Is this also going in the dental school?
I'll make sure you get it. I'm not quite sure, but I'll make sure you guys get it. Come talk to me after, and I'll give it to you. Okay? So what do people think is the answer here? C. Good. So remember, breakdown of alcohol is a two-step process of alcohol dehydrogenase and acetaldehyde dehydrogenase, and C, acetaldehyde. There, that is what causes the patient to feel kind of crappy after drinking alcohol, and is what disulfiram is looking to increase as a way to change this patient's behavior. So if I were to ask you then, what enzyme is disulfiram inhibiting, what would you say?
Them2?
Yeah, it's going to inhibit this enzyme to build up C. Okay? Any questions? Okay. So, a patient presents to the physician because she wants to improve her nutrition. What constitutes a healthy diet? Talk about the importance of vitamin C. What is important? What of the following statements about the function of vitamin C is true? What do we think here? Scurvy, good, but there's another, this is actually a tricky question. Yeah, but it's also involved in iron absorption. This got me too, but you just want to be aware, that's why I put this in here. You just want to be aware of this other function, facilitates iron absorption, but again, the main thing is collagen synthesis and hydroxylation, and you want to be on the lookout for scurvy. So anemia, they'll have cork tears, and bleeding, often from the gums, is something you want to look for. So that will often present in people, elderly people who are depressed, only eating tea and toast and not getting a full diet might get scurvy. Okay, so you want to be able to look out for that.
Yeah, so again, like letter E is essentially just trying to trick with you. It's not a carboxylation, it's specifically a hydroxylation reaction, which is actually holding together the different aspects of collagen.
I initially guessed E, so again, back to the ETC, but rotenone is a chemical inhibiting NADH or nicotinamide adenine. Which of the following? So it's a competitive inhibitor. Which of the following combination describes the effects of rotenone on the enzyme kinetics? So think about competitive inhibitors. What do we think the answer is here? Let me get hands up for A. Hands up for B. C. D. Good. So the answer here is C. So remember, competitive inhibitors are going to increase Michaelis-Menten, decrease the binding, and won't change the Vmax. The non-competitive ones will change your Vmax, but no change to Km. Cool? Great. So a 6-month-old child has to thrive, developmental delay, respiratory tract infection, diagnosed with a disease of this enzyme which phosphorylates mannose residues. In this child, what happens to the enzymes that are normally the targets of this protein? What do we think of the answer? This is actually another tricky question. This is going to be exocytosis. So this is a tricky one. There'll be exocytosis, then go to lysosome. Cool? This is a tricky one. Another tricky one. A previously healthy 23-year-old man presents with a headache that starts 2 hours ago. It's the worst headache of his life. That's a tip-off. He has changed vital signs and highly stretchable skin with bruising. What do we think is going on here? Okay. So this person is having some sort of brain hemorrhage, causing the worst headache of their life. Okay. So that makes this sketchy, stretchy skin is highly indicative of Ehlers-Danlos syndrome, okay, which is a disease of type 3 collagen, okay? Type 3 collagen will give you highly stretchable skin and bruising, and will also increase the likelihood of these types of vascular accidents, particularly in the brain, okay? So then the other things on your differential diagnosis here, other collagen diseases are Alport syndrome, which is type 4, which will generally give you deafness and kidney issues. And then Marfan syndrome is more fibrillin 1, which is definitely increasing your risk of these types of accidents, but wouldn't really have the stretchy skin and would also kind of present with different symptoms.
Yeah, they're just like super tall, like really lanky joints and everything. So.
So next one, 18-year-old woman is having trouble running to catch a bus, find herself unable to jog, okay with long, slow walks, but is bad at these quicker bursts. One, you want to think about what she has. 2, you want to think about the enzyme. And 3, you want to think about where this enzyme is localized in the cell. Okay? So what are people thinking? What disease do people think she has here? Good. What enzyme is wrong there? Good. And where is that localized in the cell? Cytosol. Good. Great. Cool. So it has McArdle's disease with glycogen phosphorylates. So this myoglobinuria can be particularly dangerous because that can damage the kidney. that might come up on your test, probably won't, but that's just something to be aware of and be considering. It might come up, particularly if she comes with renal failure. That's something you want to be aware of. It's localized to the liver, and it's due to a defect in chromosome 6. And as REM said last year, play golf, not tennis. Is it? Okay. Yep. Then you're right. Then okay. For some reason I thought it was a liver, but okay. Cool. Then you're right. Cool. Kate, you want to present on the cyanide poisoning?
Okay, so I don't think this is like particularly high yield, but just to explain cyanide poisoning, so essentially you don't want that cyanide in your blood and blocking that last step in the electron transport chain. So there's two components in that antidote kit. So basically there's nitrates and then there's sodium thiosulfate. So why do you give the nitrates? So essentially you want to convert your blood into methemoglobin, which seems like counterintuitive, like already making the situation worse. But actually by having that in your blood, it absorbs the cyanide, so it's not going to be attacking your electron transport chain. And then the second part to the kit is that you have sodium thiosulfate, but it's not enough on its own. It absorbs some of the cyanide. So these two parts basically block it from like completely destroying your electron transport chain. I could post this to the group if like reading's easier.
Yes.
I just have a question, because
Yeah.
we did learn cyanide affects that specific structure, but we didn't learn like those aspects. They're nowhere listed on the slides. So are we responsible for that? Like, should we be looking things up in first aid and everything? Or
You're likely not going to be responsible for it if it wasn't covered in class.
Okay,
Yeah, usually the slides are pretty comprehensive, so. Yeah.
As
We're
to what
giving you a
you're
little
actually
extra
responsible
detail.
for.
It might be helpful in just kind of understanding it conceptually.
Yeah.
Sometimes I find like understanding how you treat it might also help you understand what's actually going on.
But we don't need to worry about that.
Probably
Don't worry about it, it's fine.
You might need to worry about it down the road, but not.
For step one, we might, right?
Step one, you will.
Yeah.
I think though generally